Hi, my name is Courtney. I have a daughter who's 9 years old, and 5 days ago she had a pharyngeal flap surgery, and I wanted to make a video to help parents figure out what to expect with a pharyngeal flap surgery, and maybe give them some insight on a way or two to prepare for the pharyngeal flap surgery. My daughter Gwendolyn, she had her surgery on Wednesday, August the 1st, and today is Monday, August 6th. She's not doing really well today. Wednesday, of course, was really rough. Thursday was really rough. Friday and Saturday, she had pretty good days. And now Sunday and Monday, she has not had good days. She's done a little bit of vomiting. She's not really eating at all or drinking much. Not up playing. Just really doesn't feel well. Is nauseated. I'm going to try to keep this a brief video. I'm not very good at this, and I'm no editor, so it's going to be kind of a rough video, but hopefully it'll be informative for you. Okay, so she had her surgery done first thing in the morning on Wednesday at Arkansas Children's Hospital, and her surgeon was Dr. Johnson. If you can have your surgery at Arkansas Children's Hospital in Little Rock and you can have Dr. Johnson, you're in luck. He is an amazing surgeon. He's super smart. He's a top volunteer for Operation Smile. He goes all over the world fixing cleft lip and cleft palate. Very energetic, very smart, makes you feel very comfortable. Super nice guy. Really made me feel confident in the whole process. So I know that he did a great job. And I would absolutely like to recommend him. And I had a little menu that I made up for my daughter after we came home, sitting on my lap. The wind just kind of picked up and blew it away, but you know. So my first recommendation for pharyngeal flap surgery would be if your child happens to not be a fan of soup, which my daughter had never really eaten soup, but one thing that I would do a week or two ahead of the surgery is introduce my child to soup. Tomato soup, chicken noodle soup, cream of chicken soup. Just, if they could develop a taste for soup ahead of time, I think that would be greatly beneficial to them. After the surgery, they're not really into trying new things. My daughter's not even eating pudding right now, so perhaps soup, because you can put it in a cup and they could drink it, would be a good idea. And then any other soft food that maybe they're not familiar with that will definitely want to put on your child's menu after the surgery. Maybe oatmeal or scrambled eggs, fried eggs, pudding and all that good stuff. But at the moment, my daughter's not even eating ice cream or pudding, so I wouldn't expect a lot. It's just important that they drink a lot of clear fluids, and that's what I would say. And like I said earlier, she's not doing very well today. She has slept most of today. She is not eating or drinking. She's not up playing. She did get up and play some on Friday, and she did get up and play some on Saturday. What I think the difference is that I don't really necessarily think that she's regressing. I think that in the OR, of course, they gave her a steroid. That's pretty common practice to get a steroid in the OR. And she wasn't doing that well on Wednesday. And then sometime late Thursday afternoon, I had asked the nurses about maybe perhaps a steroid, because when she got her tonsils out, they had given her a steroid, and they had actually given her a steroid to come home with, and so she took the steroid every other day, and that really affected how she was feeling at the time, was the steroid. And so I'm wondering, after I brought that up, the nurse talked to an ENT doctor and asked, would that be possible to get a steroid? And it was prescribed, and so she was given 2 doses of the steroid, one early Thursday afternoon and one Thursday night. So I think perhaps that kind of stayed in her system for Friday and Saturday. And so she had better days, and then perhaps Sunday and Monday, today, it's kind of worn off. I'm not really sure why she didn't get the steroid to come home this time like she did with her tonsils. I mean, this is definitely a much more serious surgery, and I do know that it would have benefited her in the way she feels. But I'm not a doctor, and I do believe that, there's a reason why they didn't send her home on a steroid. So she doesn't have a steroid, and I think that that's playing into how she feels. So I'm imagining in a day or two, perhaps she won't be having maybe a withdrawal or just maybe just a couple more days of healing, and she'll feel better. She has today and tomorrow to take her antibiotics. So she was sent home with pain medicine, oxycodone, and she was sent home with instructions to alternate the Tylenol and the Motrin, of course. And she was sent home with an antibiotic. Now, she's 9 years old, but she does not swallow pills, and even if she did swallow pills, I doubt she could swallow these capsules. She got prescribed clindamycin, 300 milligrams or 3,000 milligrams. Like I said, I didn't really prepare for this video. I'm just trying to help. If your child gets sent home with clindamycin and you have to open the capsules to put it with food or drink or water and make them a liquid form for them to take, well, God bless you. And I did taste it. It's horrific. I tried everything. I've tried mixing it in honey. I tried mixing it with her other medication. I tried mixing it, with the Motrin, tried mixing it with the Tylenol. But she's on about a 12.5 milliliter dose for Tylenol, or 12.5 milliliter dose for Motrin. So that's quite a bit of liquid to mix it into. So when it's nasty, I figured out that the smaller amount you can mix it into, the better. But then again, the fewer times that they have to take medicine, because if you're alternating medicines every 2 to 3 hours, taking an antibiotic 3 times a day, taking oxycodone about 3 times a day, taking Motrin 3 times a day, taking Tylenol 3 times a day, that's a lot of 3 times a day. So whichever medicine has the smallest amount, which in her case, she's on 4 milliliters of the oxycodone. So lately, that's what I've been doing is opening the capsules of clindamycin and mixing it in with oxycodone just to cut down on the number of times she takes medicine. I tried a million things. I tried honey. Like I said, I tried mixing it in her Motrin. I tried mixing it in the Tylenol because she actually prefers the berry flavor of the Motrin, and she just hates cherry flavor, and she hates Tylenol. So I didn't want to make that any worse. I even looked up online suggestions, which was mix it into like a teaspoon of chocolate frosting, and I thought, well, that should mask some of the taste. It doesn't. I mean, by all means, try what you're going to try. You can try the chocolate frosting if you think it's going to taste better, but I mean, in what I've experienced so far with the clindamycin, there is no masking that taste. And I don't know if if there's a reason that they prescribed her capsules. They didn't ask me if we preferred capsules to liquid, but I do believe that it's available in liquid form. So, perhaps I could call the doctor and get them to change it. But like I said, today and tomorrow are the last days. She was on clindamycin for 5 days. 5 days after we left the hospital. See, and we didn't leave the hospital right away. We left we went in Wednesday morning, early in the morning. She had her surgery. She stayed there that night, and their rule for getting released for the hospital was that she had to consume at least 8 ounces of liquid and keep it down in a 3-hour time period. It definitely makes sense as a good rule, but it was late on Thursday before she was actually able to make that happen. We almost spent another night in the hospital. We literally got out of the hospital at 10 o'clock at night, Thursday night. So, it was really touch and go, and I really didn't know if she was going to drink that fluid or not. But she definitely wanted to come home, and she just barely did it. That's what you can expect. Expect a night in the hospital. I'll also tell you this. One other thing that I would do to prepare is talked to the doctor about perhaps putting a little bit of Vaseline on the corners of the mouth, because my daughter's is cracked open and bleeding, and he said that they do put that on there, because I noticed it after the surgery, and she was complaining that it hurt in the corners of her mouth. And he said that, you know, for some reason down in Ecuador they see that a lot, and I'm guessing maybe in Ecuador they have kind of maybe smaller mouths. But my daughter Gwendolyn, she has 22q deletion, so she has small features as part of the characteristics of 22q deletion. So the corners of her mouth were cracked, and they're actually bleeding now. You know, I supplied her with chapstick to put on her lips, but just kind of talk to your doctor, your surgeon, before going in about the Vaseline in the corners of the mouth, especially if your child also has 22q deletion. Because the reason my daughter had the pharyngeal flap surgery is due to a VPI, Pharyangeal insufficiency, which is also characteristic of one of the possible, expressions of 22q deletion. So her palate was too short, and one thing that they did to make sure that the surgery went really well is they took her tonsils and adenoids out a minimum of 3 months prior to that, to give that time to heal. They used I want to say he used a low heat process just to make sure that it healed the best that it could, to kind of prevent any issues with obstructive sleep apnea. Be happy to post your questions below, and I will be happy to answer what I could, but I've already taken up a lot of your time, so I'm going to go ahead and end the video here for now. Post your comments below. I'd be happy to post a copy of the menu that I made my daughter for soft foods after she got out of the hospital, and I look forward to your questions, and if I can be of any help, and good luck with your surgery, and good luck with the recovery. And if you've been diagnosed with a VPI and like nasal speech, and perhaps no other diagnosis, I mean, one very common thing that you might look for is 22q deletion syndrome. It's actually, I want to say, the second most common genetic disorder. So, you know, if you have a heart defect and possibly a VPI, and you haven't had genetic testing done, then I would recommend it. Thanks so much for watching the video. I hope it's helped. I hope it wasn't too boring and too bouncy and too terrible. But if you have any questions, let me know. Thanks.